Dressed without a smile. So this morning I have Dr. Gary Hirsch and Dr. Larry Adelson here to show us how you can reinvent your smile. So good morning, gentlemen.
Good morning.
So I guess when I think about smile reconstruction, the first thing I guess I think about is white teeth. So let's talk a little bit about that. Bleaching, is it safe? Should you do it at home? Should you do it in a dentist's office? How does that go?
I think it really varies per patient. Sometimes just over-the-counter products will work great. Sometimes when we need to get a brighter smile, you do have to have an in-office bleaching. I think they're all safe if used properly.
Okay.
I think that's the critical thing. When you need a more intense smile, sometimes you have to double up on the processes. If we do an in-office bleaching, we find that still whitening with trays afterwards will get the ideal brightness for the patient.
Well, maybe sometimes I know when I use at-home whitening things, my teeth are really sensitive, so I have to use it over and over. You know, I have to do like a 2-week process, and with my sensitive teeth it doesn't work, but maybe going into an office with one treatment, would that help with sensitivity?
Not necessarily. I mean, we do a lot of things. I think there's a pre-preparation for bleaching that we put our patients through so the teeth are less sensitive when they come in to the office, so we can bleach a little bit longer.
How white should you go? Is there such thing as too white?
Well, I think that's a question is there. It's really your own personal style. I think the patient has to determine, just like the clothes you wear, what works best for you when you look in the mirror. So it isn't for the dentist to figure out. It's as long as we're not having sensitivity or gum tissue issues, the patient will determine the color that they feel looks best on them. Certainly skin tone, hair color have a lot to do with it.
Can depend on it. So what about cosmetic sort of dentistry if you want to maybe change your smile? Are we seeing that in celebrities today?
Absolutely. I have a list of celebrities that includes Whoopi Goldberg, Tom Cruise, Nick Cage. It goes on and on and on. We had Cindy Crawford. I actually had some pictures to show you, but I don't know if they're going to come up.
I think we do have a few pictures actually of some
Gwen
celebrities that
Stefani.
might have veneers. Maybe they'll come
Many
up.
times.
Here's
Tom,
Here's Tom Cruise before. Take a look at that smile.
Wow, I had no idea.
There's Zac Efron before and after. These are all braces. There's
So you think braces did this? Is this actually like fillers with...
Most of these are braces, and then some of them had braces and then had some cosmetic restorative work afterwards. Now, for instance, look at Chris Rock. Look how long his teeth were. I love this. I don't care what her teeth look like. She looks fantastic. And
They're smaller in the second picture.
That's Kate Beckinsale. Now look at bleaching. Look at the color of her teeth. Here's a good one. That's great. Denzel Washington. Now, you can tell he had braces first.
Absolutely. So what does someone, I guess, need to know if they want to maybe do something to change their smile? What are maybe some things they want to avoid? Like longer teeth, like too big? Can that happen? How do you determine what makes a good smile?
Well, a person that's a real gummy smile, you're going to see it because when they smile, like Lily Tomlin used to have, when she smiled, you saw about a 1/4 inch of gum up on top. If that's the case for an adult, you almost require surgery to actually fix that. If it's minor, Dr. Adelson and our wonderful periodontist can actually do some magic tricks to make it look like it's not so long.
Yeah. I think one of the things you have to realize that we have limitations as cosmetic dentists or general dentists. And one of the things that Gary and I have really spent a lot of time doing is multidisciplinary cases where we, I think, put together a team of some of the finest dentists. And in order to do braces, I can't do a great case if the braces are really needed first. So I will consult with Gary, have the patient, maybe a surgeon, maybe a periodontist, and the case you'll be seeing is one of those multidisciplinary cases. So
let's take a quick look at that, actually. Mike is a patient that you guys worked on, I believe.
Exactly.
And you sort of completely redid his whole smile. And this is a before picture we have right here of Mike, I think, and then an after picture.
Now, the thing about Mike is when he bit down, his whole upper jaw fit inside his lower teeth. So all the upper teeth were totally encapsulated by the lower teeth. You can't really see it in that first picture. But so we had to widen the smile first and get the room. We actually created a gap in his front teeth, and pull the teeth together, and then push his lower teeth back or upper jaw forward to make them fit, because I had to go from here to there to there. So let me show you that. From here to there to forward, and then make everything fit. So with the picture you're seeing, Dr. Adelson finished that off so beautifully. Those front teeth look so natural.
That looks good. So you can pretty much do anything.
But it's, again, when a general dentist looks at the case, I think you have to have an idea of what you can accomplish and bring in the specialist to do for you so you can look like a superstar, because Gary and our surgeon just made me look great. And that's the critical part of getting to the finest dentist to do each phase. One-stop shopping in complex dentistry, or sometimes in any dentistry,
you gotta have
isn't the best way to do it.
The experts
Correct.
for you. And if you at home want more information on how you can achieve your perfect smile, you can check out Dr. Hirsch and Dr. Addison on our website, fox5cno.com, and click on the Scene On tab. Raul?
Okay, Allie, thank you very much. Hey, ladies, be honest out there. How